The rate of increase of HIV infection in the country remains to be high. Data from the Joint United Nations Program on HIV/AIDS, or UNAIDS, show the Philippines has the fastest growing HIV epidemic in Asia and the Pacific region. Infections have increased by more than 200% from 2010 to 2019. UNAIDS explains the COVID-19 pandemic has also affected the country's HIV response. Now, to help us understand the situation, joining us now live via Zoom from Geneva, Switzerland, is Paula Munderi. She is the HIV Prevention Team Leader and Coordinator for Global HIV Prevention Coalition at UNAIDS. Good morning, Paula.
Good morning, Paula.
Thank you for joining us. Now, Paula, UNAIDS Executive Director Winnie Byanyima held a two-day virtual mission in the Philippines. She met with health officials and other stakeholders via video call. Can you tell us about the key points that were discussed?
Thank you, Paolo. Yes, I had the privilege to escort our Executive Director, Ms. Winnie Byanyima, on a virtual mission to the Philippines, the first of its kind. And we had the privilege over yesterday and today, our morning, to meet initially with civil society leaders in the Philippines, civil society leaders in the HIV response, as well as with key government representatives in the national HIV response, such as the Department of Health and the Senate. We also had the opportunity to visit, virtually of course, a very inspiring community center, the Raja Community Center, which is a community-led HIV clinic run by Family Planning Organization of the Philippines in Iloilo, and to see and experience firsthand what very courageous community members are leading in responding to HIV and the problems of the community, especially at this time, especially during the COVID pandemic. So we're very inspired and extremely energized by what we saw visiting that center as well.
All right, Paula, let's talk a little bit more about the HIV situation in the Philippines. It's an alarming rise. In 2020, it was found that there are over 111,000 people who are living with HIV. What do you think are the factors that contributed to this rise in infections? We're talking about a 200% rise over quite a long span, but still we're dealing with 111,000 people in this situation.
You're right, Paolo. The Philippines does indeed, as you say, have one of the fastest growing HIV epidemics in the world, and the fastest in Asia and the Pacific region. The rate of new infections, the alarming rate rise of about 237% between 2010 and 2020 has been concentrated mainly among key populations, particularly young gay men and transgender women in urban centers in the Philippines. At the same time, and of course, as a consequence, AIDS-related deaths have also increased by about 450%. And this is despite there being available in the Philippines free life-saving treatments available in more than 160 treatment facilities across the country. This recent rise in new infections seems to be a new wave. This is something that we're familiar with in the time of COVID, because it is a new wave of infections in a newly affecting a population of young people, and quite possibly one of the main factors might well be that having very initially in the early days responded satisfactorily to the HIV epidemic, it is quite likely that the Philippines took their eye off the ball and stopped concentrating so much on prevention programs, but also the fact that the most affected populations in the Philippines are young, marginalized populations who are not easily reached with mainstream health services and mainstream programs.
Okay, that being the case, Paula, what do you think leaders in, as a leader in HIV prevention, what do you think that our leaders must do to improve the country's HIV response, especially amid this pandemic where, treatment becomes harder and so on and so forth?
Paolo, I will not pretend to instruct your country in what they should do. The good news that we learned on this mission really is that the laws, the policies and guidelines are in place in the Philippines to support innovations that will give people options for preventing HIV infection, for gaining access to testing and care across the spectrum of possible interventions. But we do need these laws and policies to be fully implemented and fully funded. So that is probably one of the first factors. There are institutions in the Philippines, the right institutions like the National AIDS Council that are quite capable of responding adequately like they've done before, and these institutions need to be supported and strengthened. It is very encouraging to read the new National AIDS policy. It's very encouraging to see, to learn about the new Universal Health Coverage Act. It is critical that in implementing the new Universal Health Coverage Act, that the Philippines includes in there HIV care and provisions for HIV prevention for those populations that are vulnerable to and affected by HIV.
Right. Well, it certainly does sound like we need to act now. Thank you so much again, Paula, for joining us this morning. That was Paula Munderi from UNAIDS.